Ever wondered what's really going on inside your veins? Well, in this explainer, we're going to pull back the curtain on one of the most important tools in vascular medicine, the venous duplex scan. Let's dive right in. It so often starts with a really simple but frustrating problem. Your leg hurts, it's swollen, and you just know something isn't right. So you go to the doctor, and they need a way to look inside to see what's going on, but without actually cutting you open. And this is right where our story begins. Okay, so when it comes to symptoms like these, there are usually two main suspects on the doctor's list. First, you can have a blockage. That's known as Deep Vein Thrombosis, or DVT. The best way to think about it is like a sudden, pretty dangerous traffic jam on a major highway inside your leg. Or the problem could be a leak. That's called Chronic Venous Insufficiency, or CVI, and this is more like the one-way gates in your veins are broken, letting blood flow backward when it shouldn't. The duplex scan? Well, that's the detective that gets sent in to figure out which one it is.
So how in the world do you look inside a vein without making a single cut? The answer is pretty incredible. You see with sound. Let's break down what actually makes this scan duplex, because it's really this brilliant combination of two different technologies working together.
So the first part of this whole puzzle is what's called B-mode imaging. Now, this is basically just a standard ultrasound. It sends sound waves into your body, and then it listens for the echoes to create a live, black and white picture of your veins. It's the map. A healthy, open vein on the screen just looks like a simple black tube. A technician would call it anechoe.
But a map is just a static picture, right? To really understand what's happening, we need to see movement, and that's where the Doppler part comes in. See, Doppler ultrasound doesn't really care about the structure. It cares about motion. It measures the direction and the speed of your red blood cells. It can tell us exactly how your blood is flowing just by analyzing how sound waves change as they bounce off those moving cells.
And right here, this is where it all comes together. When you combine that B-mode picture, the map, with the Doppler flow information, the traffic, you get a duplex scan. You're not just seeing the highway anymore. You're seeing the cars moving on it, which way they're going, and how fast. It's this combination that makes the scan such a powerful diagnostic tool and so incredibly accurate.
So we've got the tech. Now let's go on the hunt and see how a skilled technologist actually uses it to find those all-important clues, to figure out if we're dealing with a blockage or a leak.
Believe it or not, when the main suspect is a DVT, a blood clot, the main way they find it is surprisingly physical. It's not some super complex reading. It really just all comes down to pressure. It's called the compression test, and it's brilliant in its simplicity. While looking at the B-mode image, the tech just gently presses down on your skin with the probe. A normal, healthy vein is soft. It'll collapse completely flat. But a vein with a clot inside? It's firm, it's blocked, and it just won't compress. That simple physical test is the #1 sign of a DVT. It's often the only way to find fresh clots that can be really hard to see otherwise.
Okay, but what if we're looking for a leak, for CVI? Well, in that case, pushing on the vein isn't going to tell us a thing. For this investigation, we have to forget all about pressure and focus entirely on the direction of the blood flow.
And this is called the reflux test. First, the patient stands up, which is crucial so that gravity is part of the equation. Then, a cuff on the leg gets squeezed for a moment and then released really quickly. In a healthy leg, the valves in the veins slam shut. But if they're leaky, the Doppler immediately picks up blood flowing backward. That's the reflux. And if that backward flow lasts for more than half a second, bang, that is the smoking gun for venous insufficiency.
So let's just recap, because this is the crucial point. The evidence tells the story. An incompressible vein that won't flatten, that points directly to a DVT, a blockage. But a prolonged backward flow of blood, that points straight to CVI, leaky, incompetent valves. It's two totally different problems, revealed by two different techniques, all using the same incredible technology.
But the power of the duplex scan doesn't stop there. Not even close. It's so much more than a clot and leak detector. It's actually an incredibly versatile toolkit that's absolutely essential in a ton of other areas of vascular health.
I mean, just think about this. Before a big heart bypass surgery, doctors can use this scan to create a perfect map of a patient's veins to find the best one to use, all without making a single incision. It's also vital for dialysis patients to make sure their access points are working properly. And for someone who's recovering from a DVT, it's the only way to really see how the vein is healing and to tell the difference between old scar tissue and a dangerous new clot. It is a true workhorse of modern medicine.
But for all this amazing technology, all the physics and the fancy screens, maybe the most critical part of the whole process isn't the machine at all. It's the human element. Because even the most sophisticated scanner in the world is only as good as the person operating it.
You know, this quote from our source material just says it all. The results aren't just automatically spit out by a computer. They are the product of real human expertise, of careful technique, and a thorough investigation. The skill of that technologist and the doctor who reads the scan is everything.
So what does a quality scan actually look like? Well, it means the facility follows strict written protocols so nothing gets missed. It means positioning the patient correctly, like we talked about, having them stand for a reflux test, because the test is useless if gravity isn't a factor. And it means the place itself is held to incredibly high standards, usually proven by an accreditation that verifies they have the right equipment, the right training, and the right procedures to get an accurate answer every single time.
So when you step back, a duplex scan is so much more than just another medical test. It's this non-invasive, powerful, and kind of elegant way to get a perfectly clear window into the hidden highways flowing inside of you, letting doctors see what's wrong with incredible precision.
It's really an amazing fusion of physics and physiology that can reveal so much about our health. And it leaves us with just one final thought to ponder. If you ever needed one, what story could this technology tell about you?